Hi, how's it going? I'm Jeff, the OT Dude, and I'm a licensed occupational therapist practicing in America. And in this caregiver training series, I'm going to talk about and show you how to use and put on a gait belt. And the first question I often get is, well, Jeff, should I buy a gait belt for myself being a caregiver and taking care of someone? Well, oftentimes actually you might not even need to get a gait belt because when a patient discharges from hospitals, at least where I work, they often get a gait belt, the one they've been using here in the hospital or in the rehab program or whatever. And also it depends on the culture of the rehab and the caregivers and the team of where you may stay. In some hospital systems or some hospitals, they actually may not even use a gait belt at all. I think for a caregiver who's just starting out, especially, having something like this is definitely much more safer because, and we're doing all this because of safety. We want to prevent is falls for the patient and injury, which could basically lead to rehospitalization, prolonged hospital stays, more cost and headache, and a lot more, even potentially death too. So that's why we want to avoid all of this, and that's to avoid a fall. And another reason to use a gait belt is because sometimes the patient may not have something on. So as an occupational therapist, I often help to train and prepare patients to go home, such as to get a shower in their own environment. And when you're being a caregiver for a patient getting out of the shower, they sometimes may not have clothes and they may be wet and slippery. So you may not have anything to grab on to. So that is another reason why I am a fan of using a gait belt, because oftentimes I have like the patient wear a gown, and if they want to get dressed in their room, for example, in the patient room, then I put a gait belt over their gown. Otherwise, if I just had their gown on, then if they were to lose their balance, there's not really that much we can grab onto compared to a gait belt where it's really tight. Also, the position that the patient is in before you start to put on the gait belt, it matters. It kind of want to work smarter, not harder, right? So if they were sitting up and like on the edge of the sofa, for example, this would make it easier for me to put a gait belt around them versus, for example, them sitting all the way back. There's a surface of the backrest here at the reach around them. There's no like space behind them or like a gap for me to reach around. And also putting it on if they were laying down makes it hard too, because then I would have to kind of go around them or make them like lift up and create a gap for me. So I'd say like 9 times out of 10, almost probably every time I have the patient sit up before I put on a gait belt, because the term gait means, G-A-I-T, means to walk. So it's the step before they walk, you put on a gait belt. So why not have it be put on when they're sitting as opposed to like laying down, for example. Which direction should you sit on or be on when you help someone put on a gait belt? Now, the general rule is to sit or be on the side of somebody that they're weaker on. So sitting on this side means that the patient is going to be weaker on their right side. So for example, they may like lean and lose their balance towards this direction. So the reason for that is because being on that side allows you to provide assistance, because if they're stronger on this side, they'll be able to maintain their balance and their strength and not fall against that way. But if they fall against this way, their weaker side, I'll be there to kind of help and support them and be of use to them and be a safety net, so to speak. First is, of course, read the manual or the instructions provided by the original manufacturer, because your gait belts that may be different, they may have a different design. This is a standard, pretty typical gait belt. Mine has an extra loop here, but yours may not, and that's okay. Just a long belt, pretty long material, and has a teeth where your belt goes through. I guess I'll show you how it works now. And it just, when it gets tight enough, it goes over to the other loop. And a good analogy to visualize is, even though this may be confusing and foreign to you, think about your own belt. When you put on your own belt, you loop it through and then you immediately put it through that little hook thing, right? It hooks through the whole of the belt. This doesn't have it. It just uses teeth and then friction. And then you loop it through like another loop down the end to help do the, what is kind of like the management of the extra slack, right? So that's why you do it this way. As opposed to, I'm gonna do it backwards. This is the wrong way to do it. As opposed to going through this loop first and then reaching around. And you'll notice it kind of seems backwards. You're kind of, if you're doing it wrong this way, you kind of have to like go back around, and it doesn't look right because you're kind of going around the teeth, and you kind of have to go like underside of it and then to loop back. It just doesn't feel as right as opposed to the other way. And also, oftentimes the tag will be inside out, it will show on the outside, but that's not always the case. So you wouldn't want to go off of that, but a pro tip is to mark it. Maybe use like a permanent marker or something and write inside, out, or outside or whatever, just like maybe to help you remember. So it makes your life much easier, right?
So I start with the teeth, go across, and then loop it back over towards that little loophole and reduce the slack by tightening it and then pulling that loose tail over. And I personally like to, with my excess, tuck it under the belt just to reduce any like potential hazards from it getting caught. Here it is too loose, and you can kind of tell when one is too loose when they kind of stand up or sit up. It kind of like falls down with the weight of like the metal of the belt. Here it is too tight. It's really exaggerated with this pillow, but you can see that it just looks way too tight against somebody, and the patient will probably tell you it's too tight. Here it is too low, so I'm putting it basically over where a real belt would go, like below the hip. So this isn't going to be too helpful because it's just not going to be comfortable too. It's like really close to the groin too. And here it is too high, like over the chest. Now, this is not saying that you can never put it here. There are some situations which I'll go over later, such as tubing and bandages, where it won't allow you to go below this spot. And here it is just right, approximately anyways. It's hard to show with this tummy because like there's just stuffing under, but you want it kind of above that hip and below the like ribs and that sweet spot, approximately where that belly button is.
Do's and don'ts of gait belt. Definitely one major don't is do not pull on the arm. What I mean is, just in general, it's not a good idea to pull on the arm when you're helping somebody, like when you see how maybe like family members like helping the elderly like walk across the street or something. They're kind of holding onto their arm or like that. It's probably not a good idea because if the patient were to have like misbalance, you're really just supporting them by this one major joint here, and that's the shoulder joint. And it's not really meant to take that much of a weight. If someone were to fall, like you can look at all this, it's all hanging off this one little poor little joint here, and someone who's like hundreds of pounds, all this can lead to shoulder injury, shoulder strain, etc., etc. And when it comes to gait belt use, it's pretty common sense. Like if you see like a tear or like it's being damaged, like frayed or something, I would probably replace it because you just don't want to risk it. These aren't like super expensive to begin with. Another thing to watch out for is just leaving it around. So if you live around pets, especially kids, like younger kids, I wouldn't leave a gait belt around because they may play with it as a toy and do something like this, and so I would not leave it around, and I would fold it up or roll it up. And another tip is to basically keep the gait belt within reach. So if someone were to sit back down onto this chair, I wouldn't like put this gait belt somewhere else. I would keep it like nearby. Or if there was a child, I'd keep it out of the reach somewhere nearby. And here are some things to avoid putting in this location. This is the most ideal location put it, which is the gait belt right above the hip, below like the chest, like below your ribs. But that's not always a place you should put it. In some cases, there may be some things that are not recommended when to put it in this location. For example, these include when someone is pregnant, you shouldn't put a gait belt like over their belly. When someone has like incisions or surgical incisions, or they just came out of surgery, let's say they had like back surgery, and if you were to look behind them, a good indicator is they have like a kind of like bandages, like somewhere there, like maybe in the center of their back, something like that. Another thing is like tubing or bags, or drains, basically any hardware or like things coming out of somebody. Another is ostomy bags. So basically anything that goes around there. Another includes just like cuts, scrapes, anything that is not like normal skin, don't put it over. So in those situations, you would put it a little bit higher because you don't really have many options. So you would put it a little bit higher. So I'll actually show where you would put it. So let's say there's I don't know, like a ostomy bag right here, or an incision site right here, or maybe they have a really bad bruise, like right under, like in their belly. Because when you put a gait belt on somebody, it shouldn't cause them a lot of pain. It should be really snug, but it's more like a snugness kind of, and sometimes you shouldn't go off of that because they might not even have any sensation too. So definitely, if you're not sure, ask the patient, is it okay if I kind of check what's going on under the shirt? I want to see if there's anything I'm going to maybe be putting the gait belt over and kind of pulling against, or kind of going against. What's the word? Like going too tight against? I don't know. So if they had something there, I would just go above it as best I can. So what you're doing is giving them comfort and allowing them to breathe, because when you go any higher than the ideal spot, then you're going into their diaphragm in their chest. And if you notice in the chest, it contracts and expands. And if you're going really, really tight, they're not going to be able to do a full breath and exhalation and inhalation. And it's going to reduce their lung capacity and their basically overall ability to do physical activity, right? So don't want to go too tight when you go in a higher location. Let's just say this is like the gait belts around them. It's better to have an underhand grip, basically. Don't hold them with an overhand grip, because when you need to provide like assistance and lift, they can slip out of your hand. Having an underhand grip allows you to have more secure grip and prevent you from losing that grip. And the last thing you want to do is lose a grip and have them slip out of your hand. And in some cases, you may have or be working with a patient who may have a larger body size, and the gait belt that you have may not accommodate them. So what do you do in those instances? Well, if you happen to have two gait belts lying around, what you can do is connect them tail to head, like so. So this is the tail of one, and this is the second one, and connect them as if you were to connect a regular gait belt around itself. And there you go. You have basically a really, really long gait belt that you can hook up to itself with a really, really large diameter. See here. Here you go. So just make sure you test it out, make sure it's pretty snug before you help the patient get up and walk and things like that. But if you only had, say, one gait belt lying around, I wouldn't say, if you can avoid it, to go out and to the store or shop online to buy a second one. In those instances, I recommend you look for a larger size gait belt, those that can accommodate people who may need a larger size. So the term to search for is bariatric. So maybe type in bariatric, BARIATRIC. I'll type it on the screen. And gait belt, followed by that term search phrase.